try to
Okay,
screen share
perfect.
so that we're
Okay, perfect. Thank you.
sure that it's working, of course.
And I'll just say next slide, next slide. That would be
Yeah,
really
that's fine.
helpful.
Can you all see the slides?
Not yet on my side. Yeah.
Perfect. Thank you.
Yep. Okay,
Perfect.
great.
Thank you.
So I'll put them down now, and when we need, I'll put them back up.
And just were you able to get the polls put in? The three
I
poll
hope
questions?
so. So that's our first time using Teams, which is a challenge for
Okay.
in many ways, right? So I did create polls here, and I have here a button that says initiate them. So I think it's gonna work. Let's see.
Okay, good.
We are 2 minutes past, so if you'd like to get started, Beatrice, please feel free to.
Okay, that's fine. Good morning, good afternoon, good day from all of us across the world. Welcome to this morning or this afternoon session of the Community of Practice on Citizen Engagement in Evidence-Informed Decision-Making in the Health Sector. So this is a collaborative between the World Health Organization, African Evidence Network, and Cochrane. This afternoon or this morning, we are privileged to be hearing from one of the key speakers on evidence and citizens engagement. We just have a brief agenda to discuss with us. We would take the presentation from our key speaker and then do a bit of Q&A at the end where we'll share and discuss on the topic. Ladies and gentlemen, I am Beatrice Sankah from Ghana University of Cape Coast. I'm part of the Secretariat and I'll be your moderator for the session. Without much ado, this morning's discussion is on the theme, Nothing About Us Without Us, Citizen Engagement in Evidence Synthesis to help address pressing health and social system issues. And to help us discuss this is Maureen Smith, who is a citizen strategy and engagement partner from McMaster Health Forum, Canada. Ladies and gentlemen, our facilitator is ready. Maureen, we've got a good number on the team, and you could take the floor. Thank you very much.
Thank you so much, Bea, and thank you so much for inviting me. I'm Maureen Smith, and I'm from Canada. I live in the capital of Canada, Ottawa, and I'm very proud to be a citizen partner committed to citizen engagement and evidence synthesis. I'm not a scientist or a researcher, I'm a regular citizen. My background is as an educator and a person who's committed to advancing patient and citizen engagement for over 25 years now. And today I'm going to present 2 citizen engagement in evidence synthesis projects. I'm going to be sure to keep to my 30-minute limit because I'm really looking forward to the question period and discussing with you. And this is a very important topic. And thank you to the organizers for all of the logistics to get this going. So maybe you can put the slides up and I'll keep going.
Yeah.
Okay. There we go. Next slide. Next slide. There we go. Okay, so yesterday was a very important day in Canada. It was the National Day for Truth and Reconciliation, and I attended the ceremonies on Parliament Hill. This is a mural that was unveiled two years ago on this important day in Hamilton, where McMaster University is found. And McMaster University recognizes and acknowledges that it is located on the traditional territories of the Mississauga and Haudenosaunee nations, and within the lands protected by the Dish with One Spoon Wampum Agreement. So it was a very special day yesterday to remember all of the children who were put in residential schools in Canada a long time ago. Okay, next slide. So I've hoping that we're going to have 3 polls so I can kind of get an idea of who's in the audience today, and I'm told that you're going to try to launch those now. So let's see if we can get them to work.
Just a second. It's my first time doing this, so let's see if they go through.
Problem.
Do people see the question?
I see them in the chat.
In the chat, it didn't pop up.
No, I don't see it on
It
the
did
screen.
pop up
I just see
for
it in
me.
the chat.
I could see questions. Yeah.
Okay.
Okay.
I guess I
For
just
me, there
don't see
was
it on
a
mine.
pop-up.
Okay. Okay.
And you should see 3 questions in this pop-up window.
Okay. You'll have to show me the answers because it's not popping up on my screen in Canada.
Yeah, I don't get a pop-up either. And when I click in the chat, it says something went wrong.
Okay,
Yeah,
I'm sorry about that.
Me too. Okay.
Maybe it's related to different versions of Teams, maybe the browser.
Right.
Yeah.
Right, Mimi. Okay. So maybe you can just tell me where people are coming from, and just give us a brief summary of what we did learn. Oh, there it is. It's showing up now. Okay. All right. So that's great. Lots of people from Africa, 50% from Europe. Okay. That looks really good. Okay. Thank you. So many researchers, people from international organization staff, intermediaries, yeah, very important. So no citizen serving people who were able to complete this. Okay, that's interesting. Okay, and the last one. Oh, that's great. So we have a really nice mix. Thank you very much for running those polls. Great to know
Great.
a little
I'm
bit
happy
who's
they
in the
worked.
audience. Yes, thank you. That's great. Okay, so we can go on to the next slide. So just a little summary of the objectives for today's session. So I'm going to talk about 2 specific projects, and then I'm going to talk a little bit about how it all fits into the evolving evidence synthesis ecosystem. And I'm really looking forward to the third part, which is really share some insights with each other during the question and answer period. Okay. All right, next slide. Okay, so just quickly, citizen partnerships, why? And we're talking, for me, those citizen partnerships in evidence synthesis really start in rapid evidence synthesis for policymakers and for decisions really started with COVID-END. And COVID-END was a time-limited network that brought together more than 50 of the world's leading evidence synthesis, technology assessment and guideline development groups around the world. And the McMaster Health Forum, where I'm affiliated, was the holder of the grant and the secretariat for running the network. And I was already committed to citizen partnerships for many years, for about 25 years now. And I realized that many of those research topics were relevant to citizens, not just to patients, and that we are decision makers, and that we were making personal decisions that have a tremendous societal impacts. And that we are able to help shape research to be more responsive to the needs for this project of Canadians, and that we have a unique knowledge that can help to interpret and contextualize research, the evidence of research. So next slide. So that understanding of patient engagement in healthcare seems to be widely understood. But why would you engage patients and citizens in evidence synthesis, and especially rapid evidence synthesis? Well, because it's the backbone of those policy decisions and the clinical guidelines and the good practices, and we are the end users. And we should be engaged in prioritizing those rapid review topics, framing the questions and have input on the outcomes, interpreting the findings to make them relevant, and then accessing the results in plain language or in ways that meet the needs that we have. But it's very challenging to do this in rapid evidence synthesis for several reasons. So that evidence synthesis ecosystem is complex, and it's definitely not public friendly. Most patient partners or citizens who are engaged in systematic reviews are involved at the end stage as peer reviewers. Now that's changing, but at that time, that's pretty well where we were all positioned. So if you were a member of Cochrane, which I was, at that time I was the chair of the Consumer Network, most of the engagement was at the end stage as peer reviewers. But that pandemic created this incredible opportunity as not only patients, but the general public were immersed in evidence. And there was a renewed interest in science, but also a very worrisome increase in misinformation and disinformation. So it was a very important turning point. And from my perspective, it was, as a person who champions co-production of evidence synthesis, it was very exciting. And I wanted to make it accessible to patients, caregivers, and the public. So that's a little bit about that project. So next slide, show a little bit about what happened there. So in April 2020, the network came together, and I was very fortunate because I happened to know the two people who were running the network. It was being run out of Canada at McMaster, Jeremy Grimshaw and John Lavis. And I said, well, what about us? We're decision makers too. How can we be involved? So they said, oh, give us a few months to set up and we'll get back to you. And they did. In July, they contacted me, and in the next month, there was a commitment to citizen partnership as part of COVID Global. And then in 2021, in January, our Canadian government funded one piece of the project, and that's where we had COVID in Canada. And we sent out this call for involvement in evidence synthesis. And it was just unbelievable. In a matter of less than 2 weeks, 80 Canadians answered that call. People from all walks of life, just ordinary citizens who wanted to be involved. And they applied to join the research team. So we tried to get a good diversity, and we picked 20 people. And we onboarded them in April of 2021. And we worked with the researchers to welcome the citizens to their teams. So we onboarded them in April. The next month, we offered training, which was specifically in rapid evidence synthesis for those policy decisions. And it was a 5-week course online. And we offered it again in October of 2022 and looked at other kinds of evidence synthesis at that point. And that was in collaboration with the Spore Evidence Alliance in Canada. And that was co-designed and co-led by two citizen partners, so myself and Janet Gunderson. And we offered a lot of training for researchers with webinars. Many of these teams had never worked with a citizen partner before. It was completely new to them, and they wanted to learn how to do it. So next slide. So our citizen pool, it turned out we had 18 people. Some people that we may have chosen may have realized that, yeah, this isn't really the thing for me. I thought I'd be interested, but when maybe they saw what it was about, they thought maybe it wasn't for them. So we ended up with 18 people, and they participated in 25 evidence synthesis projects. And we facilitated that collaboration with the research team. So I was kind of like a bridge between the researchers and the citizens. It was me in the middle, who's a citizen, so they could relate to me. But I have the background of being in evidence synthesis for many years, but I was also able to communicate with the researchers. So I understood a little bit about what they were doing, and I understood the challenges that were there for citizens. And we consider that they made significant accomplishments, like perspectives on the outcomes that were important to the public, and identifying key messages, and disseminating in plain language and innovative formats, and really advancing a broader role for citizen engagement in evidence synthesis. And that was quite new. They also participated in horizon scanning, and then were invited to the global horizon scanning panel. And they really contributed to synthesizing the best evidence to support decision making about COVID-19. We developed a lot of resources which we made available on the website, and people were using those to help them in their work. Next slide. So training was really important. You can't just, knock on your next door neighbor's door and say, here, do you want to do this? So you really have to offer training, and you have to offer it specifically targeted for citizens, and we did that. So we did those two. We had 47 attendees who participated in the two training programs, and to really give them a basic understanding of what knowledge synthesis or evidence synthesis, sometimes in Canada we call it knowledge synthesis, and rapid reviews were, and how they can provide feedback, and just to onboard them on the different projects and improve that collaborative experience. As I said, many of the research teams had never worked with citizen partners before, so it was all new to them, and to try to minimize the barriers so that different people would be able to do that work. My last slide on that project is the next one. So at the end, we brought everyone together and we asked them about their experience. We evaluated their experience, and they gave us a lot of insights about what worked and what didn't work, which was very helpful for us as moving forward with the work that we're doing in that area. So things about the importance about building this network and how to do that, and how to engage them, how to onboard them, so how to bring them on to a project so that once they start, they have an idea what they're supposed to do. And then during the actual synthesis, tips from them about what was helpful for them, and then at the dissemination stage. And we were really grateful that they were able to be so frank and to tell us, this didn't work or this was really good. And we built on all of that information that we received. So that was really good. Okay, I'm going to go on to the second project. And that is at the McMaster Health Forum. And this is a group out of McMaster University, and they're all about synthesizing evidence. You've probably heard of them. They're fairly well known. The leader is Dr. John Lavis, and they do a lot of work in Canada, domestically and globally. And they were the ones who had the grant for COVID-END. And then in their forum, they decided that, okay, we've done a good job with evidence synthesis. We've got people involved. Let's keep doing this. So that's what sparked this citizen panel. And I'll go to the next slide actually before I talk about the panel. So next slide. So the forum receives requests to synthesize evidence, and they're often urgent, and they're usually from government policymakers, the leaders of systems, etc., organizations, sometimes researchers, but most of the evidence that they produce is requested by federal government agencies. So the Public Health Agency of Canada or provincial governments. We have our health system in Canada is decentralized. So we have each province and territory has their own system. So they get a lot of requests from provincial governments and other interest holders. We used to use the word stakeholder. I think we're moving to the term interest holders now. So big, very, very big groups. And they receive these requests. Sometimes they're also global topics. They call that global public good. So that's where most of their work occurs. And they produce most of the synthesis in-house at the McMaster with the McMaster Health Forum staff. And they also collaborate with research teams across Canada who are interested in working with the citizen partners. So that's the requests that I'm going to concentrate on as those urgent ones that come in from decision makers. Okay, next slide. So what is it? So they use the synthesized evidence to inform policies, develop guidelines, and make health-related decisions that are based on best evidence. And well, it's pretty clear to say that these decisions impact citizens. But traditionally, we have not been involved in that world. That ecosystem has not included citizens. It's been all of the other stakeholders or interest holders, but not citizens. So that this is quite new. Okay, next slide. So we brought together 18. We have 18. Seems to be the magic number. We have 18 citizens who are part of what we call the Citizen Panel for Evidence Synthesis, and they're from across the country. So we don't have a population of 45 million, but we're spread out very far across the country in 5 different time zones. So that's always a little challenging. And they are people who have experience partnering in research in various domains, like maybe public health or clinical, or research about health and social systems. They're based in different regions of Canada. They're able to read at an intermediate level and either speak or write, even at a basic level, in English. And they have interest in evidence synthesis and willing to participate in training. That was really important. So in March, in 2024, we began a pilot project with about 6 people to try to get it started and see what would work and what didn't work, and kept asking them for feedback. And we were fully operational in March 2025 after that pilot project. Okay, next slide. And these are the types of evidence synthesis that the people are involved with. So those really quick ones, rapid evidence profiles or living evidence profiles, which can be done in 1 to 5 days. Then a little bit longer, a rapid evidence synthesis or a living evidence synthesis that's updated at regular intervals. Next slide. Or it could be a full systematic review. That's not as often, and that's the main types of evidence syntheses that people at McMaster Health Forum do. And I've got the components there for you just out of interest. So we'll probably be able to circulate the slides later. People want to go back and take a look, but this is what a synthesis would look like from this group. So next slide. These are examples from 2024 of some of the topics that they tackled. So the Mpox outbreak, the pandemic planning and response, nurse to patient ratios in hospitals, and implementation of real-time patient feedback programs. So you can see these are topics that would be important to patients, but also to citizens. So very much focused on public health and in rapid decision making. Okay, next slide. All right. So it all sounds really good, right? Oh, this is great. Let's get citizens involved in this work. But there are lots of challenges, and I've offered a few of them with a couple of solutions. So the first big challenge is the quick turnaround and tight timelines. Like some products are completed in less than 2 weeks and others in days. And when the pandemic struck in Canada, we had a pretty good system of especially patient engagement in research. And all of a sudden it seemed to be, oh, well, we can't do it. It's too fast now. And only 30% of our projects actually had patient engagement. So the assumption was that if it's too fast, then we can't develop those trusting relationships, and we can't really involve citizens. And when citizens said, well, who decided that? Who made that decision that we couldn't be involved? We understand it's a pandemic. We understand it's an emergency. Don't shut us out. So we do want to be involved, but give us the best estimate of the timeline. We'll accept if we think that timeline works for us. And if it's not a good time, we'll just take a pass and we'll wait for another invitation. But it's okay to say that it has to be done very quickly, as long as you tell us why. Like, why are you rushing this? Well, this is an emergency situation, and that shouldn't preclude us being involved. So that was quite interesting. People wanted to do the right thing and develop the team and that. And they said, well, that's great in most circumstances, but that should not mean that we can't be involved in synthesis to make, that is aimed for decision makers to make very important decisions about our lives. The second big challenge that we have is that people say, well, I'm not a scientist or a researcher. What am I doing in this world? What we kind of would call, imposter syndrome. And well, the answer to that is pretty simple. The team already has many scientists and researchers. That's not what they're asking you to do. They're looking for your perspective as a citizen or a person with lived experience in a specific area. And that's where the next challenge, which is the training, comes in. So even if you say that to someone, well, you don't have to be a scientist or a researcher, you still have to be able to understand what evidence synthesis is, what it's not, and be able to read that report. So that's where the training comes in. But they're not reading the report to look at the statistics, maybe. They're reading it to, I'll show you some examples of the kind of questions that people can kind of answer. So the training part is really important to help them with the basics and how to engage, but also to give the training to the researchers for how to welcome those citizens and how to incorporate, what they're going to bring to your project. So that piece is really important. And then we talked a little bit about building that relationship in short time frames is challenging. And we know that a lot of good collaboration is based on good relationships. But the reality is that things are going to move quickly. And that's just the reality of the request for those products. If you create a group of citizens who can be engaged on several evidence synthesis, you then bridge that, because then you've worked with them before, you bring them back on, they've met you now, they kind of know how things are working, and they can jump into other projects. And because they're often public health questions, they don't have to have a certain condition, for example. They just have to be a citizen who is going to be affected. We're all affected by public health. So building a team that you can go back to and do some training with, ongoing training with, is really important. And that's what we did in both projects. And people have several opportunities to actually get involved that way. Okay, next slide. So what do we ask citizens to do when they review an evidence synthesis? It might be, if it's a rapid profile, it might be 10 pages, for example. So has it prioritized and extracted outcomes of interest to citizens? We're going to hand this over to decision makers or to governments. Well, are those outcomes of interest to us? Do the findings resonate with us as citizens? And are they being looked at from a citizen lens? And do you see any knowledge gaps? Like, have they identified the knowledge gaps? We're especially really good at doing that, I think. And then often citizens can write, or they can review plain language summaries if the project develops one. That's really very helpful too. Okay, next slide. So we have one of our researchers whose name is Dr. Carrie Waddell, and she leads a lot of those evidence synthesis along with Dr. Mike Wilson. And I asked her, can you give me some specific questions to guide that citizen feedback? Because people were nervous when they started. Oh, am I answering the right questions? Am I giving enough information? So she developed all of these questions, and our citizen partners just love these because they're really detailed. So it's about the different pieces of the review. So looking at the background, like, do you understand the policy issue? And don't forget, those syntheses are going to policymakers. They're not experts in that area also. So whatever we say as citizens is really helping them too. And then about the key messages, what do you think? Are they drawing the reader's attention to the right points? Then, of course, always looking at the gaps about what was found, and then even the overall language has to be accessible, because they're written for government decision makers usually. So they're not written for scientists to scientists, they're written scientists to government decision makers. So do you think that language is accessible to them? And do you have, any suggestions about the clarity? And then telling them that, there's not much that's out of scope, but you can't ask for direct inclusion of personal experiences, subjective conclusions. It's a synthesis, right? So it's based on the evidence that's already out there. And but even any requests that are there to make changes are still useful to have, because it helps people understand how it could be interpreted or understood. So I'm going to stop there for that project. And I've got a couple of slides about our bright future and then right on to the question period, if that's okay. So next slide. Okay, so we're doing all this work and along comes the Evidence Synthesis Infrastructure Collaborative known as ESIC, which is, I'm sure most of you know about it, but a global initiative supported by the Wellcome Trust that aims to create a coordinated global infrastructure for producing, sharing, and using evidence synthesis like systematic reviews to inform decision-making on major societal challenges. So not just health, we're talking about environment, education, health, etc. And this started in January of 2025. I'm very proud to say that I was involved with that as a citizen member on the governance planning group. And so, wow, this is the first time that we've got this huge project now and that we're actually part of it. So there's 5 steps. And what you can see is that this is part of what they call the ESIC roadmap, that we as citizens and citizen-serving NGOs are integrated in all steps of that roadmap. So I'll go to the next slide. And it really is a very bright, promising future for us. So this is just a couple of very small examples of where we are in that synthesis infrastructure. And so on the demand side, they're going to develop a citizen panel. They've promised to do that, to operationalize the citizen call to action. Talk a little bit about that after. There's a lot of citizen engagement and data sharing in the safe and responsible use of artificial intelligence. In the methods, so methods to support wider co-production and application of synthesis findings, and also in the tools and resources to support our citizen engagement and the use of evidence syntheses. So that was very encouraging to see that. Go on to step 2. All right. Oh, there we go. Okay. So make user-centered evidence synthesis the norm. So that was really important, and to include us in development and addressing the priorities of decision makers. Okay, on to step 3. I see there are some intermediaries here today. So work with intermediaries. Those are the people who are between the researchers and the recipients of the syntheses, are facilitating all that work. Really important role, but we need to work with them. So citizens need to work with those intermediaries and to be users and co-producers of the evidence. Okay, and step 4, next one. So really ensure that we're getting the best evidence, and that more people start using those actionable insights generated with rigor and speed. So really, really important. And finally, at the end of the day, the goal is for everyone to enable better informed decisions to improve our lives and save money. And I think that's why we're all here today, is about better informed decisions. Okay, next slide. So here we are at Cape Town at the meeting that was held in June. So apart from the roadmap, they also produced what was called the Cape Town Charter. And I put 2 little quotes from the charter. So we are embedded, citizen engagement in evidence synthesis is embedded in that charter. So it was agreed upon, and they are embedded there. Okay, next slide. Okay, and one of the big products that came out of the citizen engagement in ESIC was a call to action called Putting Evidence at the Center of Everyday Life. And this call to action is supported by the Evidence Synthesis Infrastructure Collaborative, and became an influential document in the writing of the roadmap, in the recommendations, and it really has 4 basic call to action. So producing the evidence that meets our needs, fostering that evidence ecosystem where we can be co-producers of evidence, enable us as evidence users, and support the role of citizens advocates for evidence and trustworthy information. And I will stop there. I think I'm right in my 30 minutes, and I really look forward to chatting with you and having you share your insights or ask any questions that you have. And then at the end, I put my contact information. So I will hand it back over to the moderator.
Yes, thank you very much, Maureen. That was quite insightful. A very good presentation from you. Thank you so much. Ladies and gentlemen, the floor is opened. You could ask your questions, unmute yourself and ask your question, or drop it in the chat, as I earlier said, so we could, Maureen can address your questions. You could raise your virtual hand as well. I could call you. Maureen, whilst we wait for questions to come through, you did mention that some partners were uneasy, not sure of what their role was in the evidence synthesis. And I want to find out, in delivering the training to the partners, citizen partners, who delivered this training? Is it fellow citizen partners or researchers? How did you go about that? Thank you.
Right. Thank you. Yeah. So the training was really led by fellow citizen partners. We felt quite strongly about that. We brought in scientists as guests and told them exactly what we wanted them to talk about. So it's very important to have them there too. But it really was all shaped and informed by what we thought was important. And then we would bring them in and ask them to speak about a specific area, and have that, and have them listen to some of the concerns that citizens had too about engaging in that work. So it was as, educational for us as it was for them. But we when Janet Gunderson and I had proposed, when the course was proposed to us, Janet had attended a evidence synthesis course. I had done all the Cochrane training, and we said, okay, but we really want it to be focused on what we think the people need, and not overwhelm them with so much information that they think, oh, there's no way I can do this. So we really try, and that's why we made it longer also, to not to just sit there and give a whole bunch of information out. So we had a lot of interactive boards where people could ask questions, and so it was quite interesting. It's a very important component of it.
Yeah, thank you very much. Maureen, Jacqueline has a question in the chat. She said, Maureen, thank you so much for the inspiring work and presentation. In your experience, what do you think is the biggest thing we can do to make citizen engagement in evidence synthesis meaningful rather than tokenistic? What skills or capacity should organizations and practitioners build if they want to strengthen this area?
Yeah, that's a really good question. And tokenistic engagement still happens a lot. And that's a very important thing to tackle. For us, we have a really dedicated team at McMaster who really wants to do this right. So like yesterday, I received 4 evidence syntheses where the team has responded to every comment that the citizen made and said why they're using it or why they're not using it. It takes time to do that. It's an investment in time. But for our citizen partners, first of all, it's very educational to be able to see, wow, when this kind of comment is really helpful and encourages them to do it again, but also to understand why certain things can't be used. And that makes it meaningful, because now you see the changes. Like, that in that document they changed that part based on what you said. That's going to decision makers. Like, they're going to read it this way now instead of that way, and maybe that's going to inform the decision that they're going to make. So I think the feedback loop, where you're saying this is what you told us and this is what we were able to use, that makes it meaningful. Tokenistic would be yes, thank you very much, and then you don't follow through. So they get to see the final report, but they get to see the comments, and I know it takes time. It is, but the team also reflects on that. Like it really, when you have to kind of be accountable to it, it makes you, oh, okay, well, I'm not using it because of this reason. So I think that one of the big skills for organizations to develop is to understand our perspective and how we present that and how they can respond to that perspective. I think that piece is really important. They can't treat us like another researcher. That's where the problem is. We have different, we're doing it for different reasons. So
thank you, Maureen. Alison, do you have a question?
No, that was my question just now that you read out. So I wanted to put myself on camera. Yeah. Thank you so much. And yes, really appreciate your insights, Maureen. I think, like you say, the investment of time and how we can, come together as a team and be partners in the work and not just, like you say, a checkbox exercise.
Yeah, thank you very much. Digana 87, please, you could ask your question.
Okay, thank you very much, Beatrice. This is Euphrasia. Maureen, thank you for your wonderful presentation. Okay. I just want to add to what Maureen already said to answer Alison's question. That I think that if we as the global evidence community could be able to come out with an evidence-based measure or tool to really capture the impact of citizen engagement in research, that could be a very good motivation for meaningful engagement of citizens in research. If we could come out with a tool that can capture and report so that we, the citizens, will see the impact our involvement makes, what change it brings to the bigger picture, I think that it would be a very good motivation for a meaningful engagement. Thank you, Maureen. Wonderful presentation.
Thank you very much.
I got kicked off the call. I was ejected from the call for a minute there. So I missed a little bit about the beginning of what Euphrasia said. Hopefully it wasn't a question. It was just her sharing her insights, because Euphrasia has a lot of experience in this area. And so she and I have worked together since many years now. So I'm really happy to hear from her. But I did get kicked off for a minute there.
Sorry about that, Maureen. She was asking whether it will be good to have some sort of reporting guide to guide, citizen engagement reporting. So it's sort of like globalized and everybody can use it. Do you have any responses to that? Because I have a follow-up. Is it comment to it?
Yeah, I think there's a lot of work being done on that. We realize that in patient and public involvement, we're very bad at reporting it. When we look for evidence, it's all over the place, or it's just mentioned, but there's no detail in what's happening. And there are various reporting guideline teams who are kind of working on doing that. And even for ourselves, we haven't published. And we did try to publish, but first of all, during the pandemic, our priority was to get the work out. So we don't always make sharing what we learn a priority because we're too busy doing the work. And I think that's not good either. But that's kind of the reality of the situation sometimes. But there are ways to absolutely report it. Right now, we're concentrating on evaluating our process. So every time someone does an evidence synthesis, we send them an evaluation and we try to work from there. But we do have plans to eventually get that out. But not always
thank you very much. Yeah, I think that I agree with the team that it's a bit sketchy now in terms of reporting citizen engagement. But I think for patient and public involvement, there's the GRIP tool that has this short form and long form that, colleagues can report patient involvement in health research. So that's a start. And then we could build up from there. So that's an addition to that as well, Maureen. There's a question in the chat for you. Was the invitation for citizen participation an open call to everyone who was interested? Or was there criteria for citizens to enable meaningful engagement? What are the pros and cons of an open call? to anyone interested versus establishing criteria to be met for citizens who can participate. That's 2 in 1. Was there any criteria for the call? And what were the advantages and disadvantages?
So we did do an open call, and there are advantages and disadvantages to that. We were trying to move away from having it just with patients who are usually the people who are engaging, right? We wanted to open it up to more of a citizen engagement because they were public health concerns. So we did do an open call. I think the biggest piece of it was understanding what evidence synthesis is. So people are very familiar in Canada, at least, with patient, involvement, engagement in primary research. So, you have a certain condition and you come on and you share your lived experience and you make really, very substantial contributions to that research. Evidence synthesis is not something that everyone talks about. So we had a lot of we're trying to provide training so people would understand that. So we were like, what is primary research? What is the difference with evidence synthesis? That was one hurdle that we had, but we did open it up. And our theory was that we're going to offer training and you have to absolutely agree to do training if you want to do this. We didn't want people to come in without some training. And I think that was really and we had people who were, who had been engaged in research for years as patient partners and other people who were just starting. And I can honestly say that with good training, I think that most people, two people left out of the 20. So that should tell you something, that maybe for those 2 people, it wasn't what they thought it was going to be and it wasn't their cup of tea. But the rest of the people persisted, and many of those are on our current panel now because we went back to them and said, you've done the training, if you had a good experience and you want to continue with this work, here's an opportunity. And most of them actually said, yeah, I would like to continue doing that work. So.
Wow, that's great. Thank you very much, Maureen. There's another question for you in the chat. Says, thank you, Maureen. Great presentation. What next for ESIG, for people, citizens, the public to get involved? Yeah.
So, yes. So they were at the United Nations General Assembly on September 22nd. The first thing that happened was before the General Assembly, there was a statement read about equity, diversity, and inclusion in evidence synthesis, and that included citizen engagement. So I was asked to co-author that statement that was read at the United Nations. That was very exciting on behalf of citizens who want to be engaged. And then the big funding announcement came, and I think it's $126 million US for the next years. But there is definitely a commitment from the group that citizens will be at the table. They'll be at the governance tables and they'll be at different tables. They have committed to that. And that's really important because we really, it's nice to say we want this, we want that, but that's the commitment, is that we are going to be there. It'll be mostly led by the Global South. So Global South citizens,
right.
Get yourself ready because there's going to be a lot of opportunities for you. And the commitment is there. The call to action, where many people from the Global South provided feedback on the citizens' call to action, has been endorsed by the group. And the call to action is very clear. We are part of the system. We need to be part of the governance. We need to be part of the committees. And we've been told we're going to be at the tables. I haven't seen any details yet, but the announcement was all very positive. I can tell you that in the roadmap, when I received the final version of it, I did Command F and I wrote citizens in, and I got 44 hits. And Euphrasia is on the call, so she was there during the process, and I can tell you that at the beginning of the process, we would definitely not have in the reports 44 hits. Some reports did not mention citizens at all. So in that 6-month period, we had a considerable influence on that project. So to me, the future is very bright, very promising, and it's going to be really important that we come together and we pool all of the resources and all the learning that we have. And that's why I was so excited to come here today, to be able to share some of it. of course, it's all contextual, right? You have to take, whatever I say that worked in Canada and adapt it to your own environment. But there's some basic principles that are there that could be transferable to your own situation. And I'm very aware of that. I'm very aware that I live in a country where engagement is really a given, but not in evidence synthesis. So it was in primary research, very strong, not in it. And there are still people who firmly believe, that we should not be there at that table. That, stay in your lane kind of thing. Let the experts do that work. And the ethic conclusion is that no, not anymore. That might have been the situation 5 years ago or 10 years ago. It's not. It's not that.
Thank you. We have less than 10 minutes to go. So some two last questions. Mary is asking that could you please explain how citizen engagement differs from community engagement and involvement?
Right. So that's a really good question. And maybe community engagement is a better option for certain groups. And there's no reason why it couldn't be community engagement. I think you have to work within the situation that you're in. And if it's a community representative who's engaged on behalf of citizens, that's great. Like if that's what works in your context, then that's what you should be doing, because sometimes that's the best solution. And you can't, force a process on people that's not realistic to them. So you have to look at your situation. In Canada, I sit on a group for clinical trials and involvement in clinical trials, and we're a patient engagement group. We have a community engagement person, because in some underrepresented communities in research who don't want to be involved, we're not involved for historical reasons or barriers. This person works with those people and comes to us and brings that voice. And better to have that person than to say, oh, we can't get anyone, right? So sometimes you have to do it in different ways. So really important.
Thank you, Maureen. Nazreen is asking that this would be a great case study on genuine and authentic public engagement. Are there any documents or publications about this process and its outcomes?
Right. That's a good question. That's what we should be working on. I think there's a lot of documents on public engagement in research, but specifically on rapid evidence synthesis, where it's done very quickly for decision makers. I'm not aware of any, but there's definitely a lot of documentation on systematic reviews and how people have participated in that. What I'm talking about is a little bit different because it's a short period, it's very quick. So I think some of it we need to focus on some of these rapid evidence synthesis that are done specifically to answer a policy question. And I think that's where the gap is.
Yeah, thank you very much. Last question from me, Maureen. We are aware that in Canada and a bit of the Western world, citizen science, public engagement in primary research, it has gained ground. It's growing or emerging in Africa. For example, we just finished the Congress in Ghana with physiotherapists, and we had a conversation about public engagement in physiotherapy. And there were a lot of challenges and questions. One being people misconstruing that to mean qualitative research, even with scientists and researchers. And that's a big challenge, really big challenge, the difference between that citizen science, that community engagement with qualitative research. How did you handle that in Canada regarding the evidence synthesis? Because people are now grappling the issue of involving citizen science in primary research. And then there's this new thing about evidence synthesis. So how did you go about it? Certainly you faced some challenges.
Yes, it's tough. Just 2 years ago, I was invited to sit on a panel to talk about, citizen and public engagement in a research network, and I was with a clinician who was, doing research in that area, and he said, "Oh, I engage the patients and the public all the time. They're all in my research studies." So we in Canada, we removed the word research subject because people thought that was not a good terminology to research participant. But that participant word has been mixed up with a PPI, like an engage or involve. In Canada, we use patient engagement. It's the same as patient involvement. We don't have two separate terms. So there's a misconception there that if you participate in a clinical trial, that you're a patient or a public partner. No, you're not. You're a participant in the research. So and it's even harder in evidence synthesis because now you're synthesizing evidence that's already out there. So you're not contributing to new knowledge. You're contributing to synthesizing that knowledge. And I think it's really trying to explain that. I use a video from Evidence Synthesis Ireland about what evidence synthesis is that I just love. It's widely available on YouTube explaining it. But you're absolutely right. There's a lot of confusion even among the scientists. So they'll say, oh yes, I do PPI. I've got 300 people enrolled in my trial. Exactly. Yeah. So really, so language is really important, and we don't have common terminology. We're all over the map with how we consumers, patients, public, citizens, and we, and then participation, engagement, involvement. It makes it really difficult for people to. So we try to use the same terms over and over again, and really to clarify what the actual role is. That's,
Thank you very much, Maureen. It's been a great discussion. We do appreciate the fact that this is still an emerging area. We're still finding our feet, and hopefully in a couple of years, we can sing the language together. And when we say this, we mean that globally. Thank you very much. It's been a pleasure having you. Our participants have been interactive and engaging as well. Thank you all for coming. At this juncture, I'll hand over to Davi Romão from WHO, Evidence Policy and Impact section to close us and give us some closing remarks. Thank you very much.
Thank you so much, Beatrice. Yeah. Thank you for hosting the meeting, chairing it. Thank you again, Maureen, for the brilliant presentation. I have many questions that I hope I can ask you next time. It was such a hot topic, right? So interesting, so important. So we're very glad that you could join us, and also to all the participants who joined us today. Thank you, and we will touch base again soon to schedule our next meeting, which will be the last meeting of the year. So have a good day.
Good day. Bye, everyone.
Thanks, everyone.
Bye.
Thank you.
Bye.